reports that we're receiving from the Venezuelan Red Cross, as you say, hundreds of people, if not thousands, killed and several thousand injured. And those numbers are expected to rise as search and rescue continues. But we're seeing that the impact goes much wider than that. We're seeing millions of people affected overall. We estimate as the Red Cross that almost 10 million could be affected so far, and that number could grow. Extensive damage to homes, hospitals, infrastructure. So the context is very challenging. Also, the operating environment is very, very difficult. I mean, it's very hard to get to some of these affected areas because of damage to infrastructure and to roads. So teams really are struggling to reach the affected areas, but very much doing their best with the resources available.
Let's begin this morning in Venezuela, because rescue teams are continuing to search for survivors from the earthquakes there. At least 900 people have been killed and more than 3,000 people have been injured. Hospitals say they are overwhelmed and they're lacking medical supplies. Times correspondent Stephen Gibbs is in Caracas.
What we've seen really over the last 48 hours since this catastrophe is a massive local effort from the people here, the Venezuelans in Venezuela, from police to mountain rescue people, but importantly, just regular residents trying their best to save people, going to the ruins of these buildings, and you see them in Caracas and elsewhere across the country, where they're pretty sure that there are people who might be alive under the rubble and doing their very best to find them. It's been a desperate scene to watch, really, because of the lack of equipment. Trying to find people buried deep in rubble when you can't move the concrete that you know you need to is problematic. It's not totally futile. A lot of people have been saved. There have been extraordinary stories, including of a mother who gave birth to a baby under the rubble and they both came out alive. Others, more desperately sad stories, a woman who was found, her dead body, cradling her child, and her child survived. What is really needed now is the equipment and the people and the expertise, and clearly that has to come from overseas. And we've been seeing it arrive on a big scale in the last few hours. Big military cargo planes from the United States, from Qatar, from India, bringing aid and people and equipment and heading to the places where most of these buildings have collapsed. So there's still hope. Time is running out, but it has been impressive to see how this has sort of evolved from a local and national disaster to one with real global attention, and a whole lot of countries around the world doing their best to try and save people and put Venezuela back on a better path.
That's Times correspondent Stephen Gibbs reporting from Caracas. We can speak to Alex Pendry, who's Head of Emergencies for the British Red Cross. Morning, Alex.
Good morning. Thanks for having me.
Thanks so much for joining us. So, the official death toll is rising rapidly, nearly 1,000 now. What are your teams on the ground saying to you about how easy, or indeed how difficult, it seems more likely, this rescue operation actually is?
Yeah, I mean, from what we're hearing from the teams on the ground, this is a major and rapidly evolving emergency. Those two earthquakes that struck just over 2 days ago have caused widespread destruction, particularly in Guerrera and across Caracas. Reports that we're receiving from the Venezuelan Red Cross, as you say, hundreds of people, if not thousands, killed and several thousand injured. And those numbers are expected to rise as search and rescue continues. But we're seeing that the impact goes much wider than that. We're seeing millions of people affected overall. We estimate as the Red Cross that almost 10 million could be affected so far, and that number could grow. Extensive damage to homes, hospitals, infrastructure. So the context is very challenging. Also, the operating environment is very, very difficult. I mean, it's very hard to get to some of these affected areas because of damage to infrastructure and to roads. So teams really are struggling to reach the affected areas, but very much doing their best with the resources available.
How prepared was Venezuela for earthquakes?
There was a level of preparedness. The response did begin immediately following the earthquakes. The Venezuelan Red Cross has been on the ground from the start, carrying out search and rescue, providing first aid and ambulance services, and supporting hospitals dealing with a surge of trauma cases. We had pre-positioned stocks within Venezuela, so items such as hygiene kits, cooking sets that could be distributed to people who have lost their homes. So that's great that level of preparedness was there. But obviously this is a huge emergency. It's the biggest earthquake to hit Venezuela in 100 years. So it's natural that in-country capacities would be exceeded. And so now it's really important that we move into a rapid scale-up phase. And so the wider Red Cross and Red Crescent movement is now mobilizing funding, mobilizing relief supplies and specialist teams to reinforce the response of our Venezuelan colleagues.
Yeah. In past crises, the distribution of food and medical aid has been politicised by the Venezuelan state. Is that something that your teams are having to contend with, that supplies get to those who need it most rather than the person who happens to have decent political connections?
That's not something that we're seeing at the moment. I mean, right now the priorities are about saving lives and stabilizing the situation, and it feels like all actors in Venezuela are very much on board with that mission. So that means continuing search and rescue operations. That's absolutely critical in the coming hours and days. Providing urgent medical care for the injured, particularly because the health system is already under severe strain in Venezuela. We're also seeing a need for immediate safe shelter and basic household items for those families who've lost their homes and can't safely return. And of course, the needs in this response are going to evolve as the situation develops. We're expecting to see over the coming days and weeks a need for clean water and sanitation, mental health and psychosocial support, because of course people have been through an incredibly traumatic experience and will need to be helped to recover and to come to terms with that and rebuild their lives.
Yeah, of course. And so are you finding there's a level of, I suppose, willingness from the Venezuelan authorities to allow international aid in? Because in the past, actually, Venezuela has kind of restricted humanitarian assistance. The Maduro administration in the past kind of considered foreign relief to be tantamount to interventionism in the state. Is there, I guess, at a time like this, those sorts of political barriers erode pretty quickly?
Well, I mean, what we're seeing at the moment is the Venezuelan government have made an international request for assistance. We're seeing very good working relations with the Venezuelan Red Cross, with the local authorities and national authorities. There is actually a Red Cross law in Venezuela which articulates how the Red Cross supports the government as an auxiliary in times of crisis. So what we're seeing is a lot of willingness to allow the wider Red Cross, Red Crescent network to mobilize and to get relief and teams into Venezuela, and high levels of cooperation on the ground and with other local and international NGOs operating.
Yeah. Alex, it's good to speak to you this morning. Thank you very much.
Thanks very much.
Thanks. Now, that's Alex Pendry, Head of Emergencies for the British Red Cross, outlining the scale of the disaster in the aftermath of these earthquakes in Venezuela. He reckons up to 10 million people will be affected.